Hello, this is the procedure for postural drainage and use of the Acapello or flutter valve device. I have orders here from the doctor to see a Mr. Barnes. He's a 57-year-old male. He's on 3 liters nasal cannula. Vital signs are stable. He was brought in for exacerbation of bronchiectasis, and he's having trouble coughing up secretions. So the doctor has ordered a flutter 3 times a day. So I'm going to check the chart, see if he has any allergies that I should be concerned about. Look at any contraindications. Is he spitting up blood? Hemoptysis? Does he have a unstable spinal or head injury or neck injury, or hemodynamically unstable? Has he eaten in the last recently? But he's fine in all those regards. So I'm gathering my equipment. I'm going to grab my Acapello, and then I'm going to wash my hands and glove up.
I didn't know that was
And then I'm going to enter the room and I'm going to enter the room and introduce myself. Hello, Mr. Barnes. My name's Tom. I'm with Respiratory. How you doing today?
Good.
Can I have you state your name and date of birth?
Mr. Barnes, 60768.
60768. Okay, good. So then I'm going to check his vitals, and while I'm doing so, I'm going to talk to Mr. Barnes about the procedure today. The doctor has ordered we do a flutter valve on you. This will help you with your retained secretion. As I understand that you when you cough, you're not coughing up any of your secretions, so this will help you do that. There you go. So let's do this with you. Check his vitals. There we go. I'm doing that. I'll check your breath sounds. All right. Can you cough for me? Or I'm sorry, take a deep breath.
I have an order for wrist shields.
Deep breath. Deep breath. Deep breath. Deep breath. Okay, I am hearing some coarse crackles, which would be an indication for the therapy. Let me check your respiratory rate.
I have an order for wrist shields. So she's a 50-year-old female.
Okay, respiratory is at 16 beats per minute. Color's good. Satin at 98, heart rate 72, so he's stable. So we can go ahead and move forward with this operation. So, Mr. Barnes, this is called a flutter valve. As I said, it will help you with your retained secretions. What there is there's a little bit of pressure on the end of this and a flutter, and as you breathe into it, it kind of vibrates your lungs and the different airways in your lungs, and helps to loosen those secretions so you can cough them out. So you understand? You with me so far?
I'm breathing through that.
You're breathing through that. What I'm going to have you do is take a deep breath in, and then seal your lips around this and breathe out just in a nice steady stream. Not all at once, just a nice steady stream. And you'll hear the flutter going, which means it's working. And I want you to do that 10 times. It doesn't have to be in a row, but just exhale a breath and then maybe take a few normal breaths and then exhale again. Try to do it 10 times over the course of a few minutes. Okay? Now, if you're ever feeling dizzy or lightheaded, you should stop and get your breath back. But you're pretty stable right now, so this shouldn't be a problem for you. But again, if you do feel lightheaded, you should stop and get your breath back. Okay, you with me? All right, here you go. And you can start anytime. Deep breath in and blow. Blow, 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 blow. There you go, there you go. Good job, good job. All right. Okay, so Mr. Barnes is going to do that 10 times. You feeling okay?
Yeah.
All right, so what I'm going to do...
Ooh, I felt that in my throat.
Oh, good, good. So what I'm going to do now is have you do a huff cough. A huff cough is what you do is 3 times in a row. You exhale like you're trying to steam up a mirror, just like this. And on that 4th time, try to get a nice productive cough. Try to get some of those secretions up and out, okay? And here's a little specimen cup you can spit your secretions into if you get some. All right, you go ahead. Okay, that's good job. All right, you get some up, good job. All right. All right, so what I want you to do, we're going to keep the acapella here. What happened to the acapella? Right by your bedside. I want you to every hour or so do that 10 times. That whole the whole thing where you breathe into it 10 times. Try to get those secretions out, and then practice that huff cough. Try to cough that stuff out. What we like to say in the respiratory field is better out than in. You with me?
Yeah. What happens if I spit into it?
Well,